All right, welcome to this explainer on orthopedic surgery terminology. As surgical technology students, you guys already have a really solid foundation in basic medical terminology. But today, we're hyper-focusing specifically on the orthopedics operating room. And let me tell you, in ortho, the margin for error is absolutely zero. Mastering these exact building blocks, literally every prefix, root, and suffix, is what ensures absolute precision in the OR. Because when a surgeon calls for a specific setup, your instant recognition of these terms totally dictates the flow of the entire procedure. You aren't just memorizing definitions here, you're learning the specific anatomical blueprints of your surgical cases. Misinterpreting even one single letter can mean prepping the wrong instruments, and well, that disrupts the whole surgical team. So let's sharpen up that vocabulary and aim for total fluency. Okay, let's jump right into our agenda. First, welcome to orthopedic surgery. Second, orthopedic prefixes and roots. Third, suffixes in the OR. And finally, common orthopedic procedures. Starting with Section 1. Welcome to orthopedic surgery, the building blocks of precision. Moving right into Section 2, orthopedic prefixes and roots. Okay, so here are our spatial prefixes. Think of these as the core foundational components of our surgical words because they tell us exactly where we're working in the body. Right off the bat, we have intra, meaning within. Next up is peri, meaning around. Then we've got sub, for under or below, and finally supra, meaning above. As a surgical tech, these prefixes instantly orient you to the operative site. Now, really pay attention to the critical one-letter difference in our quantitative prefixes here. Hyper means excessive, and contrast that directly with hypo, which means below or deficient. I mean, literally one single vowel changes the entire clinical picture. We've also got poly, for many, and an, meaning without. And here it is, the absolute central building block of our entire specialty, osteo/o, meaning bone. When you hear osteo/o, you know immediately that the rigid skeletal structure is the primary focus of the intervention. It's the bread and butter of ortho. Next is arthro, meaning joint. You're definitely going to want to take a mental snapshot of this spelling for your charting because it appears in countless procedure names. Basically, wherever two bones meet, you're going to find arthro. But hey, orthopedics isn't just about the bones, right? It's heavily about supportive structures too. Myo is muscle. Tendono is tendon, which is the tissue connecting muscle to bone. Then ligamento connects bone to bone. And chondro stands for cartilage. Try to actually visualize handling these specific tissues in your hands as you review these terms. Moving over to the spine, we have some very specific root words. Spine/o refers generally to the spine itself, while vertebra/o refers specifically to the individual vertebra. Now, I really want to point out the bottom two here. Scolio, meaning curvature, and kypho, meaning humpback. These two actually describe conditions, sure, but they become essential root modifiers in the names of spinal surgeries, which we're going to see in just a minute. All right, Section 3, suffixes in the OR. So if prefixes are our location and roots are our anatomy, suffixes are the action words. They describe exactly what the surgeon is going to do to that anatomy on the table. So let me pose a really critical question to you. What is the actual difference between cutting a bone and removing it? Think about it. As a surgical tech, if you prep for a cut, but the surgeon is actually planning a full removal, you've got the completely wrong instruments on your Mayo stand. The real-world stakes of understanding these next suffixes are huge. The crucial difference entirely comes down to the suffix. Otomy means an incision, or cutting into. Contrast that side by side with ectomy, which means removal or excision. Confusing an incision with a removal fundamentally changes your setup, the pace of the surgery, and ultimately the patient's outcome. Let's quickly review a few other common suffixes. Iitis is inflammation, and ostomy is creating an opening, but I really need you to lock in on plasty, meaning surgical repair, and scopy, meaning visual examination. Honestly, you're going to see these two on your OR schedule almost every single day. Our final two suffixes are heavily action-oriented. Raphifi, and notice that spelling, the double R and the H, means suturing. And then absolutely vital for our spinal paces is desis, meaning binding or fusion. Whenever a joint or vertebrae needs to be permanently locked together, desis is the suffix you'll see. Wrapping up with Section 4, common orthopedic procedures. Now we get to combine our building blocks exactly how they're going to appear on the daily surgical schedule board. It's kind of like a giant puzzle. Arthroscopy merges joint with visual examination. Right below it, arthroplasty combines joint with surgical repair, which is what we often call a total joint replacement. As you can see, the terms themselves directly dictate the surgical intent. Next, we take osteo, combine it with automati, and that creates osteotomy, the cutting of bone. Then we have meniscectomy. This is the removal, the ectomy, of the meniscus cartilage in the knee. Finally, tendon repair requires the suturing, or tenorrhaphy, of a torn tendon. Let's break down these common spinal procedures. Laminectomy is the removal of the lamina, which is a part of the vertebra. Then we have spinal fusion, which is totally synonymous with arthrodesis. Remember that desis suffix meaning fusion? So arthrodesis is the surgical binding or fusion of the vertebrae. And finally, kyphoplasty. Linking that root kypho for humpback with plasty for repair gives us the surgical repair of a vertebral compression fracture, usually done to restore spine height. Okay, I want to dedicate our focus entirely to a procedure you are going to see relentlessly in trauma cases: open reduction internal fixation. Take a second to really lock in this full spelling. You'll almost universally hear this referred to by its acronym, ORIF. But to properly prepare your plates, screws, and drills, you absolutely must know exactly what each of those words stands for. We've built these words all the way from their smallest roots right up to complex procedures. So, I want to leave you with this question. How will your precision with this vocabulary impact your next surgical case? Because when you can decode a surgical schedule with zero hesitation, you start anticipating the surgeon's needs before they even have to ask. You truly become the reliable backbone of the surgical team. Keep studying these spellings, keep mastering your craft, and step into that OR with absolute confidence.